Hi guys, it's X. Welcome back to my channel. On today's video, I'm going to be discussing COVID vaccine, why I got it, what changed my mind about getting it, side effects, the vaccine card, pregnancy, and maybe a couple of conspiracy theories that I do not agree with. Before we get into that, I want to discuss my credentials, and I am a firm believer that if you're going to watch somebody or believe what they have to say, that they should be credible. So I have been a nurse for 4 years on ICU, telemetry for a couple months, and PCU, or step down, whatever you'd like to call it. I have an associate's degree in science, technology, engineering, and mathematics. I have an associate's degree in nursing, a bachelor's in science in nursing, and I'm currently working on my master's in science in nursing in adult gerontology, acute care nurse practitioner. So there are my credentials. I have listed them for you. I have been floating to the COVID floor since March 21st, about 1 to 2 times a week, every week since then. I just want to let you know before we start this that this is not a reflection of my job or my school. This is 100% my personal opinions and my story. This video is not intended to make you feel like you absolutely have to get the vaccine. This is not me trying to push the vaccine on you. This is simply me sharing my experiences, my story, why I got it, so that if you are considering getting the vaccine, you feel a little bit more comfortable knowing at least my story. So in October, late October, early November, I believe, I was sitting at work with a couple of my colleagues, and we were all discussing whether we were going to get the vaccination when it came out. And I was like, hell no, F no, I don't trust it. I think it came out too quickly. I don't know any long-term side effects, blah, blah, blah. And my pharmacist that works for us was sitting next to me, and she had explained to me the mRNA process, how it's the safest vaccine that we've ever had, and that it will not get you sick because of the process of it. So I'm going to explain that a little bit more, and after her explaining it to me, it made me feel a lot more comfortable. So when you get like the flu vaccine, you are getting a live or attenuated, meaning a weakened form of the virus. Your body, basically your T cells, B cells, whatever, they go and they see this antigen, they make antibodies, and then the next time basically they see the virus, they already have that code and they will go and attack it. This mRNA vaccine actually just gives your body the protein code for it to make, so that when it sees the virus, it will go and fight it off. So that made me feel a lot safer. Does it alter your DNA? No. It's honestly doing the same thing your body would do if it saw the vaccine, if it saw the virus itself without actually encountering the virus. So that alone made me feel so much better. One thing that I'm going to briefly talk about here is that the flu vaccine has been known to cause Guillain-Barré. My fiance doesn't receive the flu vaccine because he has a close relative of his who had Guillain-Barré and almost died from it. Guillain-Barré is something that you can get from any type of infection. It happens to be linked to the flu vaccine, and that's why he does not get it. My fiance did get the vaccine, because the COVID vaccine, because of the method and knowing that there is no infection that's going to be triggered in your body, so he did receive it. So that's what changed my mind. Another thing that changed my mind was that we need herd immunity. I believe you need 90 to 95% of the population to get the vaccine in order to have herd immunity. So that was another thing that made me change my mind. It has been an absolute horrible year. People are losing their lives, people are losing their jobs, people are losing their loved ones, their significant others, and some people have lost everything. If my small price to pay is getting this vaccine so that I can be part of this herd immunity, then I will do that, because I hate going to COVID. I don't know any nurse who loves being on COVID, who loves gowning up and wearing all that PPE. I suffer from claustrophobia and I get panic attacks when I feel like I can't breathe. And I have had over the last couple months, lots of months, to retrain my body like when I go in there, to stay calm and not feel like I am gonna die in there because I can't breathe. I cannot be the absolutely greatest nurse that I can be on COVID because I cannot do what I would do on a normal floor without the PPE. I can't give them, my patients, the personal experience that I would give because 1, they can't see me, 2, they could barely hear me, 3, I have to go in there, limit my exposure, and do what I have to do and get out. And I certainly just cannot wait for all of this to be over. And if this vaccine gives us that glimmer of hope, that is exactly what I'm willing to do. Also, I believe the people who are in the clinical trial are 6 months behind. So if there was any side effects or anything like that, I think we would have known them. So that was another thing that changed my mind, and what I feel now is kind of silly. But I totally understand. There are a lot of people out there who are saying that they're gonna wait 6 months. We don't know long-term side effects. I'm not here to judge you, but if you've ever put a sip of alcohol to your mouth, a cigarette to your mouth, went to a rave and popped some Xannies or ecstasy or some unknown pill that you don't know what is and how it can affect you, or you do know what cigarettes and alcohol can do to your body, don't sit here and complain and be a hypocrite about long-term side effects, okay? Yes, I am 100% firm believer that you put in your body what you want, but I don't like to be a hypocrite, so I'm not gonna sit here and worry about long-term side effects of this in a pandemic, especially after seeing the ingredients and stuff like that. But by all means, you do what you want to your body. It is your choice. When I got my vaccine, I got it on December 17th, 2020. I got the first Pfizer vaccine. I will get another dose in 21 days. So the side effects that I have from the pamphlet, I'm going to read them to you, are injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, redness, nausea, feeling unwell, swollen lymph nodes. Another thing is possibility of anaphylaxis, which would include difficulty breathing, swelling of the face and throat, fast heartbeat, bad rash all over your body, dizziness, and weakness. I did not get any of that. I got arm pain for a day or two, which is something that I have experienced with every vaccination that I have ever had. My fiance and my best friend at work both had arm pain. They claimed so severe that they couldn't sleep. But the difference between me and them, that I realized at least, is that I got my vaccination after work and I went home to sleep. It was painful, but I was able to sleep. My fiance and my best friend got their vaccinations before work, then went to work, and after that, they were using it. So I think the exacerbation of constantly using it is what kept them awake. I'm not sure. That is just my theory. So another thing that changed my mind and why I felt it was a little silly is, what is 6 months going to tell me? What is waiting 6 months and possibly missing the opportunity of getting the vaccine now, and God only knows when they're going to have more, a possibility. I was talking to a couple of my friends about this, and a few of them have changed their minds because of it, because honestly, what's going to happen in 6 months? I don't know. People who were in the clinical trials have already, I believe, surpassed that 6 months. So if anything, I would know. I get it. You want to feel a little bit safer, possibly waiting a little bit. But this is an issue now. People are losing their lives now. People have lost their jobs now. So that is why I decided to forgo the waiting 6 months and forgo waiting to see what happens to everybody else, and decided that for myself, I'm just gonna go ahead and be safe than sorry and just go ahead and get the vaccine now. So the next thing I want to talk about is, why do you need 2 doses? Because there's people who are making that a big deal. Well, I have gotten multiple doses of many vaccines. I got my hepatitis A vaccine about a year, within the last year, and I needed 2 doses 6 months apart. Another thing that people have talked about is this whole conspiracy theory of you're gonna need a vaccination card everywhere you go now. Okay, well, yes, I did get one. Here it is. I'm turning that off so you can see it. And I also have one for every other major vaccine that I've gotten. So is this new? No. Here is my list of Hep B, MMR, and Tdap, and the dates are 6/23/2001, 8/10/2001, 5/14/2001. You know, like it's just, it's kind of silly to me that people are making a big deal out of this card when this has been in practice for years now. Do I know whether they're gonna require you to have a vaccine like everyone's thinking in order to do anything anymore? I don't know, but I do know that I have a vaccination card for a majority of the vaccinations that I have received. Why do you need more than 1 dose? Well, like I stated before, I have, I believe, 3 doses of hepatitis B, 2 doses of hepatitis A. I've gotten a Tdap every 10 years since I've gotten the first one, and I get an annual flu shot. That's just how some of these things work. And then pregnancy. In my little pamphlet here, it says that if you are pregnant or breastfeeding, to consult your doctor. And so I am going to find that and show you that there is, what if I'm pregnant or breastfeeding? Turn this light off right here. It says to consult your doctor, discuss your options with your healthcare provider. Personally, from my experience, I'm going to just tell you I am almost going to be 32 years old. I'm going to be 32 in January. I don't plan on having kids for the next maybe 4 or 5 years. So once you're over 34 to 35 years of age, you run the risk of having all Down syndrome or any other genetic diseases, birth defects, and stuff like that. So my personal experience, if in 5 years I decide to have a baby, I will not be able to share with you whether I can link this to the COVID vaccine. Why? Because I'm an older and will be an older patient and older mom. If I was in my early 20s, it'd be a lot different. I probably would be able to say, oh yeah, I got the COVID vaccine and, you know, now I have a birth defect. Who knows? But my personal story, I cannot agree or disagree with that when I decide to have children because of the simple fact that I will be an older mom. Another thing and a couple things that I want to talk to you about, and I am very open-minded. When I hear conspiracy theory, I want to understand why people believe in it. I am not here to make fun of anyone's beliefs or, you know, criticize it. I am trying to be as open-minded as possible, and it's kind of like that whole thing, keep your enemies close and your friends close and your enemies closer. I want to understand why people believe things and why they are so passionate about it. And a couple of things that I have watched and read through these conspiracies is, 1, the ingredient luciferase, 2, potassium chloride. And I'm going to share with you what is actually in this vaccine and whether I agree with these things or not. So potassium chloride, I'm going to totally debunk that because I have seen multiple posts of people trying to link potassium chloride to being in vaccines and how it's so deadly and how this is the ingredient that they use to kill prisoners. I give potassium chloride intravenously, probably one of the most used drugs that I use in an ICU setting. Anything that you have consumed or eaten, there is a possibility of a side effect. And yes, if you run potassium chloride too quickly, you can kill a person. But this is why we have patients on monitors. This is why there is a time frame to give potassium chloride. So yes, potassium chloride is in what we use to euthanize people. This is in what we use to replace potassium in patients, but this is also something you can eat in a banana. So yes, it is in the vaccine. I will shut this off so you can see it. I will show you here that these are the ingredients. I kind of laugh that this is polyethylene glycol, that is Miralax, that makes you poop. Here's the potassium chloride, some sugar. So let me see what else. I don't see luciferase in there unless it's one of these 4-hydroxybutyl anzalid things. I don't know. I did not look it up because I did not care to. I'm not the type of person that goes around thinking my government is trying to control me or that someone is always constantly out to get me. That is just not me. If you believe that, that's fine. That's your opinion. I just want to share my experience with myself and how I did not have any side effects towards the vaccine. If anything, it would probably be the second vaccination that I get that I would be more worried about for getting anaphylaxis or an allergy to, because that's usually, not everything, but usually how it works. Your body comes into contact with something it doesn't like, it makes antibodies, and then the next time it sees it, it will attack it. So I don't know, we'll see in those 21 days whether I have an allergic reaction or not. I will keep you posted. I will keep you updated. Like I said, this is not at all to convince you or to try to force you to get the vaccine. This is just my shared story, my thoughts and opinions on what I've encountered with it, why I got it, and side effects that I have experienced, which I didn't get any besides the minor arm pain. Other than that, so if you guys have any questions, I will try to answer them as much as possible. Other than that, have a great day. Okay guys, COVID vaccine, nobody be scared. There you go. Thank you.